welcome to my channel. The topic of today's video is the route of administration of a drug. So the route of administration is divided into two types. The first one is the local, the second one is the systemic. As the name suggests, local means the administration of the drug at a local site. अगर हमारे हाथ पे बर्न हुआ है या हमारे हाथ पे लगा है तो हम वहाँ पे एक क्रीम लगाएंगे, ना कि हम उसके लिए कोई टैबलेट लेंगे कि वो पूरी बॉडी में हमारे सर्कुलेट हो एंड देन उसका एक्शन हमारे उस जो इंजरी है उसके ऊपर हो. सो द लोकल इज़ दी, वहाँ पे हम लोकल चीज़ें अप्लाई करेंगे, लोकल एप्लीकेशंस करेंगे, लोकल चीज़ें अप्लाई करेंगे जिसकी वजह से वो पेन या जो इंजरी है वो जल्दी ठीक हो, ना कि हम पूरी बॉडी को इसमें इन्वॉल्व करेंगे. ठीक है, ये हो गया लोकल. सिस्टमिक का मतलब होता है एक ऐसी कंडीशन जिसके अंदर लाइक हम उसको, फॉर एग्जांपल डायबिटीज़. अब डायबिटीज़ जो है तो उसके लिए हमको इंजेक्शंस लेने पड़ेंगे या उसके लिए हमको मेडिकेशंस लेनी पड़ेंगी. सो एग्जांपल ऑफ द सिस्टमिक इज़ दी diabetes. So now the other types of the local are three. That is the topical, then the deep tissue injections, and the third one is the intra-arterial injections. So the is the tropical are the external applications that we use like in oceans or lotions and ointments and creams and powders and other things like sprays and all. And the deep tissue injections are like intra-arterial injections, hydrocortisol acetate injection for the knee joint, for the knee pain and the knee joint, then the retrobulbar injections for behind the hydrocortisone acetate injection behind the eyeball. Then these are the injections that we use in a deep tissue injections for a local action. Then the intra-arterial injections like for the for making a contrast medium for an angiography or in the cancer of the limbs, we can use a femoral artery or a brachial artery to pass the drug in the affected arm. Then these in the systemic we have the three types. The first one is the enteral, eternal and the parental. The third one is the other. In other there are many more, four types. The eternal and the first one we start with the topical, with examples of topical and all. So the topical. So the topical in for example in a skin application, if we take skin application, so skin application, in skin application we take like antibiotic cream. So we give mupirocin cream. In antifungal cream we give clotrimazole, and in steroidal creams we give hydrocortisone. Okay, so these are the skin applications, the topical skin applications, that external applications we use in the injury and all. Now let's see about the in eye complaints, what are the topical applications we use. So in ophthalmology we use the eye drops and ointments. So the eye drop we use is the Cipro ciprofloxacin drop, and the ointment we use is the timolol for the glaucoma. See, this is about the ophthalmology. We use these drugs. Then about the ear application or otic, we use drops. The first one is the ciprofloxacin drop and acetic acid drops. Then let's do the nose one. So in nose we use the sprays and the drops. So what are the sprays we use? The first one is the corticosteroid spray and oxymetazoline. Oxymetazoline is a spray is used for the nasal congestion, and these two are used for allergic rhinitis. In a severe allergy and rhinitis, we use these sprays. Now, the last one in the topical is the dental. What are the things we use in a dental? So, in dental, we use the mouth gels or lozenges. So, what are they? The example of that are the chlorhexidine mouth wash, and the second one is the benzene gels that we use. Okay, now let's come with the uh, deeper injections, deep tissue injections. So in deep tissue injections we use two types of injections, that are the hydrocortisone injection for the two different conditions. The hydrocortisone acetate injection in knee joint as well as in the behind the eyeball. In knee joint we can say that a intra-articular injection, and in articular joints, so in intra-articular injections, and if we are giving in a behind the eyeball, it is called as a retrobulbar injections. So these are the two deep tissue injections. Now let's do the intra-arterial injections that are given in the cancerous condition and to form a contrast medium angiography. So I've already explained that. Now let's do the systemic one. In systemic we have three parts. The first one is the internal. In internal we have the okay. So in internal, first thing we do is the oral medication. Oral. In oral form, we can give the medication like in a tablet form, in a capsule form, or in a syrup. we give in a three forms. So in a oral, let's take an example of the metformin, then the paracetamol, then the amoxicillin. Okay, so we can give this in a capsule form or a tablet form or in syrup form. This is the oral form of the medication we can give, and this is a most oldest type of method of giving medications. Now the sublingual and the buccal or buccal. In the sublingual and buccal, we give the, for example, this nitroglycerin we can give, or maybe buprenorphine we can give. Okay, you can take a screenshot of these or note it down in your notebook. Then for a rectal systemic, if we are giving medication to a unconscious patient, or any patient who have undergone a surgery, and the medication is not to be given from mouth or orally, so we can give it rectally. So the suppositories, the medicine which are given rectal in a through the rectal are the, for example, diazepam in status epilepticus patient or a kid, and the second one is a paracetamol. If the patient is unconscious and can't take the medicine for the fever or a high grade fever, you can give the paracetamol rectally. Then the parental route of administration of the drugs are the, you all know that, IV, IM and subcutaneous. IV, IM and subcutaneous one. So in the IV, IM and subcutaneous, in IV we can give the ceftriaxone. In IM you can give insulin. You can give diclofenac, and in subcutaneous you can give the insulin. This is the IV, IM and subcutaneous injections. Now the last one is the transdermal patches that are used. So in the transdermal patches, the examples are fentanyl patch or nicotine patch. Okay, this is all about the eternal. Now the parental is we have already done that, the subcutaneous, intramuscular, intravenous and the intradermal injections. In the other type of the systemic that I have already mentioned, that in the let's revise what we have learned. Route of administration of drug is divided into two parts, that is the local and the systemic. In the local we have already learned about the tropical type of drugs, then the deep tissue injections, and then the intra-arterial injections, deep in tissue injections and intra-arterial injections. Then in this systemic we have learned that the eternal, then the parental, and the other. In the other we have the inhalation medication that we give through the inhalation route, then the nasal, then the transdermal and the transmucosal. These are the other types, and we are going to learn in the next video. Thank you so much for the watching. Non-absorbable drug given orally for action on the GI, on a mucosa, that as is sucralfate or vancomycin. Inhalation of the drug action on the bronchi, we give in a oral in a inhalation route are this salbutamol and fluticasone propionate. This is the extra part we are going to do in the next video. Thank you so much.